Hey everybody, Dr. Steve Krause here. As you know, I've owned 19 different practices over my career, as well as I helped buy and sell over 412 practices nationwide, helping chiropractors be successful. Today we're going to do a deep dive into the top 3 areas to grow your practice, and not doing them can cost you hundreds of thousands of dollars. The first one we're going to dive into is the front desk. Their ability to develop confidence and to keep patients wanting to come into this practice so that nothing's driving them away is one critical factor. The second area that we're going to cover is diagnostic excellence, making sure that you have clinical excellence with the right diagnosis and communicating that diagnosis to the patient. And finally, your overall communication through your first 3-day procedures, as well as your progress examinations. How you say things to patients is going to result in building trust and gaining referrals. We're going to start with the front desk. I've said it before, I'll say it again. Your front desk staff, with all the important tasks they have, if they're not doing them properly, can cost your practice 25% of your revenue, and they can help grow your revenue 25%. So get a good one, pay them well, and train them and monitor their performance over time. I used to have a staff person that I thought was golden, and she had been with me for over 13 years. So I just assumed, as the queen bee in the practice, that she would be training all the other ones the right way. Well, we hired an outside firm to record the phone calls as patients called in, and especially what I'm going to call shoppers or new patients who know they want to go to a chiropractor but haven't decided which chiropractor they should go to. And the vibe or the answers that they get on that telephone when they make that first call can make or break their decision to stay and choose you in the practice. So we recorded my 13-year veteran, the superstar, or so I thought. And these recordings showed she did not close them. They left because she couldn't competently answer certain questions about insurance coverage or getting them scheduled. The patient smoothly said, "I'll give you a call back," and she accepted that answer without closing them and scheduling them. There's an art to this factor. So let's talk a little bit about that front desk and start with the live entrance of a patient walking in. So we're going to start with an established patient or even a new patient walking into the practice through the front door. Now, you're often so busy, or you're back in your office doing notes, or you're in the adjusting room performing adjustments, so you don't see what's happening. Have you thought about putting a camera and recording it, and occasionally spend some time fast forwarding through the recording and see, is your front desk staff making eye contact and looking at that patient as they come through that front door? Something that simple, and having a smile on your face and greeting them, and preferably by name, but at least greeting them with a friendly wave or hello, acknowledges that now they know you know they're in the practice. How many times have you gone to a specialist, especially for some of you older, maybe you've gone to a cardiologist or even gone to the dentist office, and they're not even looking at you as you're walking up to the front desk. And then finally, after standing there for 3 seconds, then they glance up at you. Horrible. Your staff must be properly trained to make eye contact and a smile and at least some acknowledgement. Let's say they're on the telephone with a new patient call in. They can still make eye contact by looking over at the person who came in that front door and giving a nice smile and a nod, showing them that I know you're here. And they see that she's on the telephone, but they acknowledge them. They could even do a short little wave. It's those kinds of extra efforts that make the difference of a friendly practice, because I can tell you in post interviews with patients, asking patients how they felt, in many clinics across the country, they've often made very rude statements about a front desk person that they hate Betty Joe at that practice because of how indifferent or how unfriendly she is. She might be great at getting all the clerical tasks completed, but if we're not friendly with that staff, that's rule number 1. We've got to make that happen. Second, let's go back to the telephone. They're on the phone, and how do you know how many patients have called in that they didn't get scheduled? Have you lost 5 new patients a month? Have you lost 50 new patients over the course of the year? Even if you've lost 10, what's the lifetime value of one of your patients? Is the lifetime value $5,000 over the course of 20 years of care? Is a lifetime value $12,000. I can tell you, if you lost 10 new patients, you've potentially lost $100,000 over the lifetime care of these patients. Now, there's always going to be those exceptions where you're not going to close 100%. So you can't expect your staff to be batting 1,000, but batting 500 is not good. You can't be losing half of the new patients who call in because they want to go to a chiropractor or they wouldn't have made the call. So right now they're shopping for which chiropractor do they want to go to. Now, some of you are going to say this, hey, if I'm getting a cheapskate patient, I don't want them. Look, I'm not talking about those kinds of patients. I'm talking about sincere, thought-oriented, and health-minded patients who want to make sure they select the right doctor because they've heard things about chiropractors. Oh, they make you come back 1,000 times. Or is he a creep? Or can this doctor physically adjust me? I like physical adjustments, or I like really soft adjustments. I don't like my neck cracked. Whatever kinds of things the patient has for their hang up, because they're not educated on chiropractic, your front desk staff has to overcome all those, and they don't need to get into all those objections over the telephone. Let's go over a scenario. Let's say a phone call comes in and Betty Jo, the patient, says, I'm having a lot of headaches. Does the doctor have success and work with these kinds of things? And what does he do to my neck? I'm a little nervous about getting my neck cracked. Well, the staff should say, Betty, Dr. Jones is very experienced with headaches. As a matter of fact, he gets very high success rates with these kinds of conditions. He's also very gentle, and he can talk to you about the different techniques that he uses so that it fits with what you're seeking. He has adjustments that are very soft, and he has other techniques to use. I'll be certain to mention that to him. I assure you that you're going to love his adjusting techniques. He treats women, children, and patients of all ages and has great success with headaches. Do you have availability later this afternoon at 3 o'clock? Or I can get you in first thing in the morning at 9 a.m. Which one's better for you? So did you notice there that in a friendly way, not in a sales tone, reassurance to the patient, the caller, that the doctor has a high success rate, and even gave a few examples of other kinds of patients that they work with for that condition, overcoming that objection, and that she would tell the doctor of her concerns. And then she even mentioned that the doctor would speak to her about what her preferences are for being adjusted. And finally, the front desk staff gave 2 appointment times, one that same day, one first thing the next morning. I assure you, if the staff person normally leaves the office at 5:30, for example, and the call was at 4:30, and your staff person doesn't want to hang around for a new patient to come in, they're not giving them the option of coming in today, they're giving them the option tomorrow. And then the patient might give an objection and say, well, I can't come in tomorrow morning, I've got this. Can I still make it in today? Or let's say Betty says, well, we don't have any more appointments available for today, but we can come in tomorrow morning or tomorrow afternoon. Your front desk staff screwed up by not getting them in today when the patient wanted to come in today. Now we're pushing them off to tomorrow. And then the patient has conflicts tomorrow. Now all of a sudden we're into 2 days from now. And now there's a decreased likelihood that they're going to show up. It's critical you get patients in the day they call and you give an opportunity for the next day. The second area we're going to talk about is diagnostic authority. It's critical in your first 3-day procedures that you perform a thorough history and examination and reassure that new patient that you understand their problem. So if we use the example of the patient who called into the front desk, she had concerns about the kind of adjustment and she's having headaches. So you reassure her that you have gentle techniques and that you can use different methods that is agreeable to the patient's desires. So in that history and examination, you're in the exam room, you're performing the cervical tests and other tests in order to assess, is it a cervicogenic headache? Is it a migraine headache? And you're communicating and speaking with the patient throughout the process. Then as you review the history, you want to make sure that you're nonchalantly talking about success that we've had and the reason that you want to take an x-ray with an A to P open mouth view. And then you use your model, your spine models, to show how the alignment of those vertebrae in the cervical spine, and you might talk about if they have a reverse curve, for example, contributing to the cervicogenic headache, or there might be biomechanical alteration of that C1, C2 level. Regardless, you're showing authoritative expertise with the patient using spine models, communicating. You're not getting too deep into the anatomy, but now you're showing them, seeing is believing, and then you take the appropriate x-rays to determine diagnostic authority. And what we highly recommend that you do is that after the exam and x-rays, that you don't go over the x-rays on that first visit. You let them know that you're going to be reviewing and doing some biomechanical analysis. And that analysis might be visual, it might be line drawings, whatever. But you're going to do a biomechanical analysis and have them come back the very next day to review the x-rays with them. Now, let's say you're one of those doctors who wants to definitely provide an adjustment on that first visit. Well, that's a decision that has to be made. Do you make the adjustment on the second visit, or do you make the adjustment on the first visit? So if you decide you're doing an adjustment on that first visit, you can still state when you go into the adjusting room, I've had a chance to look at those x-rays and I found A, B, or C. I'll go over them with you tomorrow because I want to do a line analysis, but I know exactly what the problem is. And then you can go into your adjustment. Keep your sentences short and authoritative. I know exactly what the problem is. Or if you decide to adjust the patient on the second day, you might apply some therapy or have them come back the very next morning to go over those x-rays and then explain the adjustment in detail, what their expectations are going to be, how you're going to be touching their body, and they have a clear understanding of what's going to happen. If you're doing manual adjusting, explain cavitation and what they're going to hear and experience. If you're using instrument adjusting, explain how that's working, and then perform the adjustment on that second visit. So next, we're going to go into overall communication to develop trust and confidence in the patient throughout the rest of their visits. So the third component of our talk today is about establishing communication authority and confidence so that the patient develops trust and they stay, pay, and refer. After all, the best patient is someone who gets great results from chiropractic, which causes them to stay, to get wellness care. It causes them to pay for their visits, and they'll refer other people because they had great results. One of the most key components to result in the stay, pay, and refer model is for you to be communicating clearly. I've seen it happen so many times when I owned my 19 different clinics and I trained the associate doctors. I would videotape them with my staff acting as a patient, and my staff knew the script, they knew what the condition was, they knew how to answer. And invariably, the doctor would often give 80% excellent communication, but then one or two sentences in their report of findings destroyed all the wonderful things that they said. Using certain words that are definitive and authoritative is essential when you're communicating with the patient as to what the problem is, when the progress exam is coming up next, and what needs to happen. For example, I've seen doctors use words like probably, it might be, it could be. Those kinds of words create doubt. So when you're going over the diagnosis and showing the x-rays or reviewing the exam findings or explaining the care plan, it's important to not be selling. You're simply stating facts with authority, whether it's based on scientific research, whether it's based on your clinical expertise and experience. It's important you state such things as, this kind of case responds best over a 4-week period. We treat you 3 times a week over the next 4 weeks, and we'll follow up with a progress examination. 80% of the patients are usually resolved by that time. It's possible if there's still some ongoing minor residuals or their correction I'm detecting isn't fully made, we may do a minor extension of your care plan at that time, but we'll assess it in 4 weeks. Or if it's 6 weeks, or if it's 8 weeks, whatever your care plan is, you'll describe that, but it's with confidence and it's with authority. And then you'll mention, I'm going to have Betty out at the front desk. go over the schedule with you and the finances. She'll explain how your insurance works and the various payment plans that we have available so that you can get the best care possible. Are you ready to get started? And then you pause and be quiet. She may have some questions for you that she'll answer. She may say, yeah, let's go. And then you go down the hallway. Now, you've already done an adjustment at this point. So they've experienced what an adjustment is like. So the fear factor of an adjustment is over with for those patients who were never adjusted before. The last critical piece is during and leading up to the progress examination. It's important throughout each visit, you're giving a positive statement about their progress or what you're finding on palpation as you adjust them. Obviously, you're asking the question on the headache scale, 0 to 10, or whatever other measurement or outcome source that you're using to monitor the headaches along the way. And you're explaining that that's normal for, again, 80% of the cases. So let's say you're at that progress exam and they're very close towards correction. And I'm not talking about just symptom reduction, but leading up to that progress exam, you've been talking about wellness care 3-4 visits leading up to that to make sure that the condition is stabilized so that there isn't reoccurrence, so that we can strengthen the area so that we don't have flare-ups or exacerbations. And you can use examples, say, look, I've worked with hundreds of cases like this, and patients who maintain it, kind of like going to the dentist, they're able to prevent more headaches from coming back. Certainly, we can deal with flare-ups, and sometimes 1 or 2 adjustments can handle that. The problem is, if this alignment continues to get stressed or not stay stabilized, then we're looking at potential extended care plans. It's up to you what you decide. I leave it up to the patients. It's your choice, but I highly recommend that we do a follow-up in 3 weeks and then do 1 more follow-up a month later. And then at that point, let's see how things went and if things stayed stabilized. So to wrap up, make sure that you've got a front desk focused on the patients, smiling, friendly, and giving them confidence that they're in the right place and answering the phone the right way and getting people scheduled and rescheduled. Secondly, diagnostic authority. You're making sure you've communicated that you have the right diagnosis, you know what's wrong, giving the patient confidence that you can help them. And finally, your communication throughout their care, all the way up through the progress examination and future exams, letting them know that you've got their condition under control and you're the person to help them. These things will surely grow your practice, and doing them, I promise you, you're going to have stay, pay, and refer with your patients. Please be sure to follow me if you want to hear more tips like this. You can find me on LinkedIn, Instagram, and TikTok. Thanks for watching.